Hello, this is Bishnu Subedi. Today I will discuss about what is a heart attack, what happens to the heart and the person after a heart attack, how do we get a heart attack, and how is commonly treated. Heart is basically a pump that receives the blood that lacks in oxygen that comes to the right side, and when the blood gets oxygen through the lungs, it goes to the left side of the heart and is subsequently pumped to the rest of the body. As we know, there are four chambers inside this pump or the heart. The left lower chamber, also called the left ventricle, is the most important chamber of the heart. In a normal heart, all the walls of this left ventricle will thicken and come towards the center of the cavity. That's a normal pumping function of the heart. Though the heart pumps the blood to the rest of the body, the heart muscle itself needs to get its blood supply, and usually does that with a network of small pipes that run on the surface of the heart like these. These are called coronary arteries. In a healthy heart, these pipes are clean and supply blood circulation to the heart muscle continuously, even in stressful situations. But in contrast, in unhealthy individuals, these pipes can get narrower due to the cholesterol or fat deposited inside them and can cause a heart attack. What is a heart attack then? It usually means the artery or the pipe that supply blood to the heart muscle is suddenly blocked. Sudden blockage of a coronary artery is a heart attack. If you can see the blacked out portion in the center of the artery, you can see a clot that's blocking the circulation due to a heart attack. This artery has a name. This is called left anterior descending artery, and this supplies most of the heart, usually 50% of the heart muscle. In this artery, if it gets blocked, a person can often suffer a major heart attack. So what happens to the pump after the heart attack? Now let's compare a normal heart and an abnormal heart pump due to a heart attack. On the left side, you can see all the walls of the heart are squeezing and moving towards the center. This is what the normal pump looks like. Whereas on the right side, the portion of the heart after the clot is not squeezing like it should because the circulation is blocked. Remember, the heart muscle is composed of so many heart muscle cells that need continuous blood supply and oxygen in order to function and to have a normal squeeze. When the circulation is suddenly blocked due to a clot, the heart muscle becomes dysfunctional, cannot function properly, and that results in the pump failure. That means it cannot send the blood forward to the rest of the body. When this happens, people will often feel sudden onset of symptoms like severe chest pain, shortness of breath, palpitations. Some people can pass out. They will often feel the fear of impending death. How do we develop a heart attack, or what is the process of getting a heart attack? Now you understood that a heart attack means a sudden blockage of heart artery due to a clot, usually due to a clot. How does this clot formation happen? A clean artery or clean pipe usually has good blood flow without blockage to the circulation since there is no cholesterol plaque or the fat deposits. Whereas a diseased artery will have the fat deposits into the wall of the pipe, in the inside of the pipe. In people with risk factors for the heart attack, for example, those who have history of diabetes, smoking, high cholesterol, high blood pressure, or family history of heart attacks, they tend to develop these fat deposits. This is usually a gradual process and that progresses over several years. However, once these cholesterol plaques or fat deposits are formed, they can rupture anytime, causing sudden blockage of the artery. This will result in heart attack and people will often feel sudden symptoms. What can happen if we don't treat the heart attack on time as soon as possible? What is the worst situation that can happen after a heart attack? Commonly, the patients will complain of sudden onset chest pain. That's also called angina. And some people feel other symptoms like sudden shortness of breath, which is called anginal equivalent. In some cases, the people can pass out suddenly due to heart attack. This is called sudden cardiac arrest or sudden cardiac death. What happens to the heart muscle during sudden cardiac arrest? Due to sudden blockage of the circulation and acute insult to the heart muscle, some of the heart muscle cells can generate abnormal rapid signals that will spread to the rest of the heart. The heart rate in this situation is so fast, usually in 200s or 300s, that the heart muscle is barely able to squeeze since it will not have enough time for the normal contraction and relaxation cycles. So the heart muscle will just wiggle instead of real squeeze, resulting in a cardiac standstill. And on the EKG, you can see this wiggling pattern followed by a flat line. That usually means death unless it's intervened on time. This kind of presentation will lead to acute pump failure. Acute pump failure, that means the heart cannot pump the blood forward at all, including brain and other vital organs. Our brain is very sensitive to continuous supply of glucose and oxygen through blood circulation. So when the brain cannot get blood circulation for more than 7 seconds, we become unconscious immediately. This happens so suddenly that if the person is standing, he or she may suddenly drop on the floor. This patient or the person with sudden cardiac death will die within few minutes if a timely intervention is not done. For example, chest compression or medications like epinephrine that will kickstart the heart, which is in standstill, and that will start pumping the heart again. Ultimately, the ultimate treatment is to open up the blocked artery, otherwise the patient may not do well. The treatment of the heart attack means trying to open up the blocked artery. So how do we open a blocked artery? Usually with a stent, or in some cases, these blockages need to be bypassed with a conduit that maintains the circulation around these blockages. This is called coronary artery bypass grafting, which will be done via open heart surgery. And in some cases, we treat them with medications like blood thinners without any procedures. So in terms of stenting, in order to place a stent, the cardiologist will pass a wire through the blocked portion of the artery. Once the blocked portion is opened a little bit, then a balloon is sent over the wire and it will be inflated. The inflated balloon will dilate or expand the narrowed portion of the artery that was clogged due to the fat deposits. After that, a thin metallic meshwork is placed in that place so it can prevent further blockage and maintains the circulation in that area. This meshwork is called a stent, and the procedure is called stenting. After the stent is placed, the patients will need to take blood thinners for a variable amount of time until the stent is fully mature. This was in short about the process of heart attack. I'm Vishnu Subedi. Thank you for listening.